Well, hello, everyone. It is Dr. Brandy B, and it is Friday at 12 noon Central Standard Time. Come on in, and bring a friend. It is time for Focus on It Friday. Let me see who's going to get here first. We're giving out prizes today. Oh, it's just your, normal recognition that you were first one to get here. But that is recognition nonetheless. Come on in. Let's see who we have here with us. No one yet, but I know you are coming. Oh, we got one big person. Miss Michelle Combs Mitchell is with us. Hello, and thank you for joining Focus on It Friday. We've got Jermaine Williams. Come on in. Thank you for joining. Hello, says Nikisha Tarver. Hey. Girl, I am doing fine, Miss Michelle. Thank you so much for inquiring, honey. I am doing fine. Who else do we have with us today? Come on in. We've got Sissy. She says, hello, Dr. B. Hello, Sissy. Girl, I say you just get dressed up and go on out on the town, honey. I love that idea. I was just reading that and didn't have time to comment, girl, but I say do it. Do it tonight, girl. Do it tonight. Take some pictures and post them, honey. Go out on a date with yourself, honey. I love it. We've got Miss Tawny Lane Evans. I hope I said that correct. Hello and welcome. We've got Auntie Julia. We've been missing you, but we are glad that you are in the building with us. We've got Auntie Miss Sadie Gresham with us. She says, hello, Dr. Brandy. Hello. Now, will I see you at 6 tonight, Miss Sadie? Or 6:30, because I cannot keep up. I don't know why I get that confused, but tell me, is it 6 or is it 6:30? I think it's 6. All right, we've got Angelica Langford is in the building. Hello. She says, hey, Dr. B. Hello and welcome. We've got Miss Jasmine Williams. She says, hey, girl. We are so glad that you are watching with us. We've got Diane Grady. She says, hello, Dr. B. And I say hello to you as well. Auntie Miss Sadie Gresham is keeping me in check. She says it is 6 o'clock, and I am so glad that we got that straight, because, y'all, I can't keep these times up. It's so much going on. September just blew up. It's so much going on. I can't keep up. All right, you all, I want you to get your questions ready, because this is the time to run something by me, okay? Everybody coming to my DMs. They just sliding into my DMs, honey, and they want to run something by me, but you better try to run it right now. This is the time to run something by me. That's what we're going to be focusing on today. Auntie Julia says she is currently dating herself at the movie watching Woman King. Oh, my goodness. Well, we'll try to whisper so we won't disturb the people there. But I hope it's good. I know it's going to be fantastic. This is a busy weekend. But I know that's going to be a great movie. So maybe you can tell us how it is going. Miss Arlene Jordan is here with us watching. Thank you so much for joining, y'all. I am out and about on set. I think that's what they say when they're filming, on set. That's what I'm doing, y'all. I'm on set. But we're going to go ahead and get started, because I know some of you all are probably sneaking away at lunch. And so we want you to get back to your jobs at an appropriate hour. Because, I tell you, I will love you and help you, but I cannot support you if you lose your job. We don't want that to happen. So I'm Dr. Brandy B, your triple board certified child and adolescent psychiatrist, adult psychiatrist, as well as pediatrician. I'm your mommy advocate. I am your friend for all things mental health. I am your first and last stop to get you where it is that you need to be. I'm the author of the best-selling book, Shine, Understanding ADHD So Your Child Can Be a Star. I am education liaison. I am here to help your educators, your teachers, your administrators to know what mental illness is, what ADHD is, oppositional defiant disorder, PTSD, MDD, DMDD, oh my goodness, all the other things that we have in this alphabet soup called mental health. I want them to know. I want you to know. I want the world to know, y'all. If I died knowing that mental illness no longer had a stigma attached to it, and that every child in the world who had ADHD was being treated for it and it was being addressed, oh my goodness, I'd be such a woman, happy woman at death. And so that is what I'm doing. I am living my life, my professional life, because I have a personal life, but my professional life is devoted to making sure that everybody is educated, informed, and aware of what it is that is mental illness, and particularly ADHD. So today, guys, it is a special day because ever so often I realize that we just need to ask questions. And this is, I mean, you all have the opportunity to ask them all the time anyway on Focus on It Friday, but sometimes you may have something that's really just on your mind and you want to talk about it. So we've got, I think it's Ilana Warmack. So thank you for joining. And we've got Andrea Joyner Oliver. Thank you for joining as well. All right, guys. So today we are focusing on running something by the doctor. So if there is something that you want to know, whatever it is, any question, there is no question that's too hard, too easy, that you may think is not worth asking. Anything. It doesn't have to be about ADHD. It didn't have to be about mental illness. Just ask me anything that comes to your mind. Let me know. This is what we're here for today. I should have given y'all some warning so you could have thought of your questions, but I bet y'all have some questions. Let's see who is here. My sister Frida Fountain is here all the way from Southern Alabama. We call that LA, Lower Alabama. We appreciate you for watching and joining us. And Miss Catrice Maddox, we've been missing you. She says, great day, Dr. Brandy. We're so glad that you are here with us today. All right, so nobody has any questions? Well, y'all know I can talk. It doesn't matter. I've got Attorney Bowler here with me. Tell him, hey, there we go. We're just out and about doing what people do when their kids, are at school. Y'all, there is nothing like that time between 12 and 3. Doesn't it fly when you gotta go pick up some kids? Golly, it flies. But anyway, while y'all are thinking of your questions, we've got a couple of new names that I see here. So I'll just do my basics and tell you a little bit about me. Because that's always of interest. People want to know who I am, how they can find me, what I do. So I'll start by telling you that while you're gathering your questions. But please go ahead and get all your friends. This is the time that people can be asking their questions of me. So I am Dr. Brandy Rudolph Bowling. I am a medical doctor, so I have an MD. I am from Birmingham, Alabama, where I was born and raised, and that is where I live now. I was educated in Birmingham public schools for secondary education, but I went to private schools for early primary education. And then I went to Vanderbilt University, where I obtained my Bachelor of Science in Neuroscience. Came home, did a year of research, and then I went and got my medical degree from Meharry Medical College, also in Nashville, Tennessee. After Meharry, I then went to Indiana University and completed a residency, which is the time that medical school graduates who are at that point called doctor really learn how to become a doctor. So we get the basics in med school, and then we learn the way we really practice our craft. We learned that in residency. And so I did a residency that was combined of pediatrics, adult psychiatry, and child and adolescent psychiatry. And then I came back home, took a job in a community mental health center where I have been working as of this month 11 years. So 11 years I've been serving 5 counties all by myself. I've been by myself probably the last 3 years. There was some in and out help along the way, but it's really just been me in those 5 counties. At some point I decided, you know what? None of those counties where I work do I live, and that means that if the people that I see, if they are not able to, if they don't work with me or live around me or live in that county, right? So essentially my friends, I couldn't see the people that I knew in my private life because they didn't live in the counties that I served. And so I started up private practice. This year I think makes 6 years or maybe 7. That I've been doing private practice, a very, very, very small private practice. And then I picked up so many different things along the way. I am licensed in 15 total states in the United States, and getting ready to do some other things. So 2023 is going to be a big year for me. I'm really super excited about that. People always ask, are you taking new patients? I am. The wait list is extremely long, but I tell people all the time that I am like Heinz ketchup. I am 100% worth the wait. I was speaking with a mom this morning, and she said we were on your wait list. I think she said either a year or 8 months, but she said exactly that. She said you have been worth it. And so that is a little bit about me. Of course, I could talk about myself. I could talk about anything for a long period of time. But I do see that some questions are here, and I see that some people have come in. So we are going to go for it. Let's see. We've got Miss Ada Elizabeth O'Neill is watching. Thank you so very much and welcome. She says hello. We've got Miss Erica Williams. She's watching. Thank you. We've got Mama Rudolph. She's in the building. Mama, your nails are paid for. They are expecting you, and they promise that there will be no shenanigans. So everything is already paid for. We've got Miss Kayla Sprinkle White. She is watching, and we thank you for doing that. Welcome to the show, everybody. So the first question, we never asked this question, so I will. How are you doing, Dr. Brandy? Oh, my God. You're right. Nobody ever asked me that question. Nobody ever wants to know how Dr. Brandy be doing. No, I'm just kidding. You all always do. I know that you do. But actually, I'm doing very well. This month has been very trying. This week has been exceedingly trying just because of life, just because you know, there's this thing that whenever something great is about to happen, you always have something to happen to kind of cause you to pause, to look around, to stop, to readjust, to re-examine, reevaluate. And so I had some things to happen, you know, but in the middle of it, y'all know I very much love the Lord. Okay, I might cuss and act up a little bit, but I love Jesus. But even in the middle of this thing going on, Jesus was still dropping little reassuring messages, if you will, that all was well. And so that kept me going. But I'm always on a half full, you know, outlook. That's how I look at the world. And so I have to make sure I have people around me who remind me that everybody is not always as happy for you as they may appear to be. And so I'm very grateful for my mom, actually everybody around me, all my friends, my nurses. They're always like, they don't mean it that way. But I'm doing very well. So thank you so much for asking. And one of the highlights of every week is that I get to come and hang out with you all, right? So whether or not y'all like me, y'all keep coming back. So that's reassuring. But thank you so much for asking. I really appreciate the question, and I am doing well because I get to live every day of my life. Whether I'm at work, at home, or whatever, I get to be a mommy to some amazing little ones. I get to be the wife of an amazing big guy. I get to be the daughter of the absolute #1 fantastic mother. And so I get to be a child of the King. Oh my God. So life is good. So life is good. Thank you so much for asking. Miss Michelle says, I have a pretty major issue with my daughter Lillian currently going on at her school. And of course, you all, anything we share here is confidential and is with the World Wide Web, okay? So you are sharing at your own leisure. And of course, anything that I say to you is for entertainment and educational purposes. We are not establishing any patient-physician relationship. So take that up with it, you know, with your own primary doctor, psychiatrist, therapist, or whatever you may have. But I'm here to give you some general education. All right, I have a pretty major issue with my daughter Lillian currently going on at her school. She's very combative and doesn't want to be at school, being bullied at school, and taking pictures of her without wanting them to, and airdropping to everyone at school. She doesn't feel safe at school and no friends. What would you advise me to do to advocate for her? Oh my goodness, that's pretty heavy, Miss Michelle Mitchell. Oh God, right out the gates. So that, you know, that's a pretty serious question. And it's a loaded question. Now, I'm no attorney, right? However, from what I understand, you know, when you're in a public setting, I think that pictures can be taken of you, right? There may be some rules that apply to having that done in a school by a school official, but I don't know what the rules would be for other students who are taking pictures of other students. Now, there may be some rules that apply as far as having cell phones at school, depending upon your district. And so that may be something worth speaking about. But I think that the first thing you need to do is have a conversation, you know, with your daughter reassure her that you are doing everything that you can to make her feel safe at school. And then I think you need to start having conversations with the administrators at your school, namely the principal, about bullying. And guys, I have not forgotten that conversation. Every week we get into an issue of bullying, which now has a very vast and broad definition. You don't just have to hit somebody to bully them anymore. We now know that bullying encompasses a lot of different things. But making sure that she knows that you're advocating for her, and then continuing to stay on the principal. If you feel that the principal is not doing enough as far as separating your daughter from these people that are bullying her, maybe putting, either taking them out of that class or taking her out of that class. And it's so unfortunate that the people who aren't doing anything wrong have to be the ones to be disadvantaged. But if maybe moving her from that class to a different wing, to a different homeroom, looking at the schedules and seeing where that can be adjusted is one thing. Bus rides and the like, and just really staying on the principal, making him or her be committed to doing whatever it is to keep your daughter safe. And it's unfortunate, but once something gets out into the World Wide Web and people start sharing things, sometimes it's difficult to even determine where it started. But again, being very strict about cell phones and the like, having the principal to make sure that the students are always being monitored, because that can be a problem. And then at the end of the day, doing what you feel is best for her. Sometimes that may mean moving her, and I am not an advocate for that or saying that that is what you should do. But sometimes, your schools, for a lot of varying reasons, like my husband will often say, we never know what sometimes those other kids have as far as 504s and IEPs, which would limit what the school can even do to them, because their parents may be saying on the other end, this is part of my child's mental illness, and so he or she may not be able to help themselves. So it can get very complex and complicated, but I think at the end of the day, what you need to do is make sure that whatever your heart is telling you is the best thing for your child, that you're absolutely doing that, and don't give up. Make sure that you continue to press forward. I really hate that is happening. It is happening a lot, more and more. And really, this is part of the reason that I'm here. Unfortunately, I feel like the people who are coming to my show are the parents whose children are being bullied. But we need the parents whose children are bullying to be here too, because something is not right with them, right? Whether or not their self-esteem is low, whether or not they don't understand the work, and so they get their kicks off of making fun of others, and it deflects from the fact that they don't know what they're doing in school, or they don't have what it is that they think other students have. We need those parents here. So if you have a friend whose child is a bully, invite them here. Don't just bring the friends whose children are struggling. Invite the friends whose parents need to be here to hear that something is not right with your child. And remember, whatever it is that we're doing in the home, this is to parents whose children are mean. All right? They get that from somewhere. So make sure that they're not getting it from you. Make sure that you're not bullying them. Make sure that you are not bullying, you are allowing them or are not allowing them to be bullied in the home by their siblings. Make sure that your boyfriend, girlfriend, baby dad and them, or whoever else is not allowed to say and do things to them that you wouldn't want them saying and doing to other people. Because truly, a lot of kids are getting this from somewhere else. And we've got to be a part of that problem. Because Miss Michelle Combs Mitchell should not be on Focus on It Friday asking us any tips about what to do for her child in this situation. Because, again, everybody should be making sure that their child knew what was good, bad, right, and wrong, and should be doing it on their end to prevent that from happening. So hopefully, it's a complex answer. And I feel like I really didn't answer it. And part of that is because I don't really know. I don't know the ins and outs of the school system and what it is that they can and cannot do. I do know that you should absolutely be addressed with compassion from your principal. And so if you feel like they are not giving that to you and they're being dismissive, then I will encourage you to go higher. They have a boss, so go to them. All right. Miss Jasmine Williams says, my son was diagnosed with ADHD and fine motor dysgraphia about 2 weeks ago. He is currently in the 2nd grade. I'm trying to get this to expand so I can see more. He's currently in the 2nd grade. Oh my goodness, why won't it let me see more? There we go. And struggling with spelling, math, and writing. What are some techniques that I can use to help him with slowing down and actually learning to spell his words? Well, Miss Jasmine, now you know the first thing I'm going to say is we've got to treat the ADHD. Now, that is upsetting to folks. And y'all know I don't talk about medicine over here. If you know, I only mention medicine when medicines are asked of me. But I must be honest with you all because we are friends. You got to treat the ADHD. That's the first step. And then once we begin treating it, some of the techniques that we may have can actually be remembered and they can bring it up and recall it. Repetition is important in learning. Unless you have a photographic memory and you're some high-level genius, you cannot look at something once, at least I can't, and know it. So we need to look at things 3, 5, 7 times before we actually know it. Learning to spell words is based on phonics. So if phonics is something that we missed in pre-K, kindergarten, and 1st grade, Miss Williams, then that means that we may need to go back to some of those basics and learn what sounds individual letters make, and then what sounds the words 2 letters and 3-letter combinations make. I think I just saw you write something else. He just started therapy for it last week. Okay, he started therapy for it. Miss Jasmine Williams, do not be shocked if therapy does not get you where you need to be. I'm just trying to tell you as your friend, okay? But that is a great first start. And remember, the treatment for ADHD is the combination of therapy as well as psychotropic medications. So medications, okay? As far as his fine motor skills, the dysgraphia, this means abnormal or absence. Graphia means to write, like a graph, okay? So he may need occupational therapy for that. Remember, occupational therapy is going to be the combination. It's going to be all those things that deal with fine motor skills. So like the wrist to the fingertips, that's going to be your fine motor skills, whereas your gross motor skills is going to be sitting down, getting your shoulder up to comb your hair. That's going to be gross or physical therapy needs. Your fine motor is going to be your wrist. It's going to be combing your hair. Opening doors, bottles, the like, opening cans, all of that is fine motor skills. Writing is a fine motor skill. So he may need an occupational therapy evaluation. And it is not uncommon that children with ADHD have horrible handwriting. And it's from probably the combination of the occupational skills deficits as well as their rushing and not paying attention to details, which is a part of the criteria for ADHD. So I think that will get you started. If he's already in therapy, strong work there. They're going to give you a lot of tips, calendars, reminders, post-it notes. He may need a 504 so that you can be in communication with the teacher about what homework assignments are present for that night or for the week. Because remember, these kids are extremely forgetful. They're also extremely disorganized, which means that he may have good intentions to do his homework that night, and he may forget to bring everything home to do it. Remember that these children, as part of their disorganization, they are extremely deficient in time management. And so, in fact, if you notice, parents, you're like, does my child really have ADHD? I don't know. I think that's made up. All this stuff is hocus pocus. If your child is bringing home a lot of assignments to complete from class, not homework, but classwork that the teacher has said finish at home, the first thing you need to do is say, does everybody have to bring theirs home? And if the answer is no, Everybody, most of the kids are doing it in class. That means that something is going on with your child when it comes to time management. So one of the things you can do, Miss Jasmine Williams, is set a clock. And especially for like math facts, which you may or may have not gotten to. I think my kids were doing it in first grade even. Do so many problems in a minute. Read so many words in a minute. That sort of thing. But again, we've got to work up to that, because the basics of reading is just knowing words and spelling words and sounding words out and breaking them down. Because remember, those sight words, a lot of them do not follow the spelling rules. You just got to look at them and know it. So going over those sight words, repeating it over and over and over again. Keep in mind that a lot of students who have ADHD will have learning disorders. So do not be afraid, parents, not just Miss Jasmine Williams. Do not be afraid to go ahead, get the child tested to make sure that we do not have a learning disorder. It is much better to know this at the front end than to wait until sometime later. Because remember, in the state of Alabama, come next year, if you're in third grade and by the end of the year you're not reading on a third grade level, you will be retained. Oh my goodness, I can't imagine that. So I would much rather have something in place right now that lets me know my child is not on level, so that we can work very hard to get them on level. That's right, somebody sent the shock face. There several shock faces are coming through. I'm shocked too. I'm appalled by this behavior. But this is the recommendation of, not just the recommendation, this is what our governor has signed into law. So make sure that your children are literally up to speed when it comes to reading in Alabama, because by third grade they will repeat. So hopefully you were taking some notes. I need to send me your notes. Take a screenshot of them, and girl, and send them to me, because I need to know what all I just said. That was some good advice that I need to jot down somewhere, put it in my next book or something. Y'all know my book is Shine, Understanding ADHD So Your Child Can Be a Star. Y'all know that, right? So yeah, all that stuff is over there too. But that's what we need to be doing. Yes, hopefully that was helpful. Let me know. We still got some shock faces coming through. Mama says, hey, mommy. All right, Candace Akins Curry. Let's see. I have two daughters that have ADHD. They both are having a difficult time in high school. They both hate their schools, two different schools. One has an IEP, the other does not. But I'm working on getting her one. Should I pull them out and just homeschool them, or should I leave them in the school? They get to school every day late, and it is making me mad. Well, now, Miss Candace, I'm so sad to hear that your daughters are not having a good high school experience. High school should be an amazing time. So the first thing we need to do is figure out, why do they not like school? Do they not like school because of the academics? And so are they behind? Do they have a learning disorder? And so they are having some challenges keeping up with the work, and the teacher's asking them to read out loud or to answer the question or to give the answer, and they don't know the answer. So what is it? I don't know. Is it social? Is it that they don't have friends, can't make friends? Do they have autism? Are they autistic? And it's been undiagnosed. What else could it be? So academics, social, are they anxious? And so being around a crowd is a big deal. Or do they feel like they're being judged when they're in public, and they feel like people are watching them, talking about them, or that they're going to do or say something wrong, which would be like a social phobia, social anxiety picture? I don't know. So we have to figure out, first of all, why don't they like school? Then the other thing we need to do is, so an IEP, go back, look at the video with Mr. Attorney Fred Bowling. He went over IEPs, 504s, and again, I've directed you all to ADAP, and if you're in Alabama, or if you're not, it's good information, because IEP is a federal mandate, so that's going to be the same across every state. So check those out as good, solid pieces of information that you can use to help with 504s and IEPs. And then the homeschooling piece, so I will admit I am not a huge fan of homeschooling, but I will also admit that homeschooling definitely has its place. One of the reasons I'm not a fan of homeschooling is because in the past, there have been instances where I have parents with 5th grade or so education trying to homeschool their children. And the programs that they were using were very much hands off. It was a matter of, here's some pieces of paper, do these assignments, and send them back to us. And if you've got a parent who has no idea what is going on, they're great parents. They just aren't well educated. And you got a 6th grader trying to homeschool, and you only went to 5th grade and barely did that. then that's a problem. But now, these virtual schools, these homeschool programs, oh my goodness, they're amazing. You're sitting there with a real life teacher in real time. You've got somebody actually checking in on you. So there's a different setup than what it was or what I imagined in my mind. I probably didn't even know what I was talking about. But I do know that there have been programs and students, especially homebound programs, where students went for months without hearing or seeing from anyone. And that is always just kind of sketchy to me. The socialization piece has been largely addressed, and some schools will allow kids to come in and do sports. You've got other means to do sports. You've got co-ops. So certainly homeschooling is not the option that it was many years ago. It is definitely a viable option. What I want to make sure though is that the student knows how to interact with other people, because they're going to be difficult people no matter where you go. No matter where you go. And the quicker you figure out how to navigate difficult people, or just even not difficult people, the quicker you figure out how to navigate social settings, the better it is for everyone. And so, Mom, again, I hate that I have to answer you all's question with a question, but hopefully I've given you enough things to go from to be able to help. So first of all, establish why they don't like school. Second of all, figure out, is there anything we can do to make that situation better? So if they're having trouble learning, can we get the IEP? Can we readdress the IEP? So if it's already written and it's not working, can we go back and look at that? And then figure out, is there bullying? Are there other issues, anxiety, other diagnoses that we're missing, and then kind of go from there. Hopefully that was helpful. Let me know below. All right, we've got Kayla Sprinkle White. I think we spoke. Congratulations, 11 years and doing an awesome job. Oh, sissy, you're so nice. Yes, girl, I've been there 11 years, honey. And believe me, when you talk about dealing with difficult people, child, when I first went there, I thought I'm going to have to leave. And then I said, wait a minute. These people paying me all this money and I'm doing what I want to do. Oh boy, let me stay here. And it has been fantastic. So thank you so much. I've always learned we have to check on our strong friends. Absolutely, honey, because we will suffer in silence, the strong ones. So we need to be checked on as well. My sister Erica Jones is watching. That's Erica Bowling. Thank you so much. Kelly White is watching. Christina Powell RN is in the building. Thank you so much for watching. I can't believe it's been 11 years already. That's awesome. Me either, Miss Sadie Gresham. 11 years in the same place. I was telling the lady today, I was getting my nails done, y'all. And I said, oh my goodness. I was talking to someone and I was, talking about a kid, and I was giving out all this medical advice, and it just hit me. I'm a real physician. Oh my goodness. Do y'all know? Like, for real. I'm going to just go back real quick. Take this point of, like, my own little privilege. Personal point of privilege. I think that's how you say it. In 10th grade, y'all, somebody's laughing at me. Don't laugh. In 10th grade, though, y'all, I realized, and this is why, when I ask these kids, what do you want to be when you grow up? I really don't care what they say. But what we need to be doing is priming our kids for what it is that we want them to be and what it is that we want them to do. I didn't know anything about college, but I knew I was going. Why? Because my grandmothers were educated folks. My mom was a nurse, you all know. My dad was not college educated, but my dad was super amazingly smart, and he was a hard worker. He was a hustler. A legal hustler, nothing that he never been in nobody's jail, okay? But that man hustled. And so at a very young age, my mama got called up to the school, not because I was beating people up or anything like that, but they said, Ms. Rudolph, you got to come to the school because Brandy is painting nails in the stalls on recess for $1. Because, honey, I was hustling then. I knew that I had to help the people. These girls wanted to be more beautiful. And I was going to help them. I'm cracking myself up. But that's what I did, okay? I was painting nails. And then I started selling the deposit slips from South Trust Bank. I would pick up a few. Sorry about that, South Trust. I hope I ain't the reason y'all went out of business. But I was selling them to the kids for a nickel. And they were buying them, honey. They thought they were checks. Now, I have since asked the Lord to forgive me for making a fool out of my peers. But That was what I was doing. I was hustling way back then, right? And so now, those were good, strong work ethics, right? So that's what your kids are watching you. I was watching my mama shopping too. I would take the tags off and have a little store at the house. But anyway, we digress. Your kids are watching you. So they don't need a role model outside of you. And I tell you all the time, you have everything that your children need. Because even if it's not within you, you are 1, 2, 3, 4, 5, 6 degrees away from somebody who has it. So in 10th grade, y'all, I decided I didn't want to be a teacher anymore like my grandparents were. I wanted to be a doctor. And so to be sitting somewhere and to just come up with answers that people ask me on the fly. Y'all, this is amazing. But I want you to know, it didn't take 2 doctors to get a doctor. In my husband's case, it didn't take 2 attorneys to get an attorney. All it took was parents who worked together, who loved each other, who loved us, showed us love, and supported us in our wild and crazy dreams. And y'all, the things that go on in my mind, some of these things are still wild and crazy. But I believe in myself, I believe in God, and I surround myself with people that are smarter than me and who really have my interests at heart. And so that's why next year is going to be even more amazing because of all that thing. So that's part of the reason why I'm here, to let you know, don't get discouraged. Y'all, I was brought to tears last night because I always run behind. Okay, I always run behind. But that's because I'm really trying to make sure that my patients and their parents have what it is that they need. And a mom told me last night that she didn't care. I said, so you're just waiting on them to get 18 so you can be done? And she said, yep. And she meant that. And this was a mama that has always been like, okay, we're going to try that. Okay, we're going to try that. Okay, let's do that. Whatever I say. And I told her something I wanted to do last night, and she told me she just was not going to do it. So when y'all are thinking about people that you want to pray about, pray for that mom. Because she's got a long way to go with that young man. I think he's in 7th or 8th grade. So just think about her and use that to encourage yourself. And I even said to her, it is a sad day when your mama gives up on you. So stay encouraged. Keep asking questions. Keep asking questions of me. Keep demanding that the people who are in charge with educating your child and doing other things for your child is doing what it is that they're supposed to do. Because they're being paid to do it. They're not volunteering. And so it's my job, right? I'm here free with y'all, but that's how much I care. I want you all to do well and your kids as well. All right. Let's see. Where am I? Classy Brown says she is not safe. Not safe, right? So true. Can she visit and volunteer? Okay. Oh, you talk about the daughter, Miss Michelle's daughter. Thank you so much. They pick at the fact that she has severe anxiety and panic attacks, and they make fun of her. And it makes it worse for her. The principal makes it seem like she's always at fault. Seems like they need Dr. Brandy B to come in and do some education on what anxiety is and what it what is defined as assault, what is defined as bullying. Because y'all know these days, these people are going so far as to say, when people say just kill yourself, they are finding those people who make similar statements, they're finding them at fault if the person actually does. And I think our youth need to know this kind of stuff, that this stuff that they're doing and saying and playing about and act as if it's okay is really not okay. And so we just need a lot of education, We are really lacking in education. Thank you for adding that, Miss Michelle. My cousin Clarence III is watching. All right. Miss Ada says, so hopefully that was helpful. Let me know. Miss Ada says the best way to get, hold on, y'all. I sometimes can't get it just says see more. Okay, there we go. The best way to get ADHD kids to get interested in learning words and focus on listening to books being read in kindergarten, meds are working. The best way to get a kid with ADHD to get interested in learning words and focus on listening to books being read in kindergarten and meds that are working. I think what Miss Ada is saying is that to get them to focus, we got to read to them. And I would agree with that. And then she says get meds that are working. I think that's what we're saying. And I agree with that. Read to your kids. Let them read out loud, right? So in the early years, remember, you're not reading a story to them so that they can tell you the whole story back. And a 3-year-old, let them do the reading, right? Let them point to the picture. Tell them what it is. Then you read a sentence. Then if they want to turn the page, turn the page. Don't act like you got to finish it in sequence. If they want to go back, go back. Because at this point, what you want them to do is come to love books. You know, learn to look at the book the right side up. Nothing more frustrating than when I have a 5-year-old telling me that they're going to read and the book is upside down. I know right off nobody's ever read to this kid because they don't even know how to hold the book. Right? So that's what we're getting them used to doing in those very young ages. Put reading, if you don't know how to read yourself, it's okay. We now have technology. So we have books that will read themselves to you or to the kid. So get them that, but go ahead and get them in the help early because reading really is fundamental. It really, really, really is. And you'll even notice that the higher you go in math, and I mean like 2nd and 3rd grade high, you've got to read the question stem. It's not just 2 + 2. It says Johnny got 2 apples. Sally has 2 apples. How many apples do they have if they put them all in one bucket? And you've got to read those words. So reading is really fundamental. It is the basis of all of your subjects. Keep in mind, if your child has ADHD and is a male, he is likely to do well in math and not do well in reading. Okay? Keep in mind that if your daughter has ADHD, she is likely to do well in reading, but not in math. So keep that in mind. Don't be afraid to get your child tested and get them the help that they need. Thank you so much for sharing that, Miss Ada. All right. Can you be more present in the school? IEPs and 504 plans are for all disabilities, and anxiety is a disability. Yes, absolutely. So we want to make sure that that is being covered. That is being addressed. Absolutely. Thank you so much, Miss Classy Brown, for that addition. I love this over here at Run Something By Me. That's what we're focusing on today. Miss Dana Anderson Payne says, I didn't want to use meds for my daughter, but it has truly helped that she's raising the roof. And girl, you know I'm raising it too. Woo! If you want to get me to party, honey, just tell me that you treated your child's ADHD, because it ain't no party like I treated my baby for ADHD party. That's right. All right, let's see. Miss Hodges Kent is watching, or I think that's a lady, R. Hodges Kent. Thank you. Miss Tanya Evans, she's watching. Yay. Let's see. Miss Michelle says they say she doesn't qualify for an IEP, but it seems like they just don't want to put one in place. So there are certain things that that will allow a child to apply for an IEP. Everybody who has ADHD will not apply. So they will not meet the criteria. So you want to go back and look at those, I think it's 11 or 13 criteria that do qualify for an IEP. So make sure that your child does qualify. But they may meet criteria for a 504. Get the 504. And then what will happen is they will do all of the things that they have according to the 504. And then if your child is still having some challenges, then they'll say, okay, we've exhausted all that we can on the 504. We need to go farther. So if they're offering a 504, please get the 504, because it may be truly that they do not meet criteria for an IEP. Miss Classy Brown says, go higher. This is affecting her learning and performance in school. Go higher. Absolutely. You got to escalate. Escalate to the next level up. Take that to the superintendent if you need to, but make sure you keep going up. Miss Candace says some of the teachers and the administrators need to educate themselves on different needs children have. My daughter was talking to a school counselor and mentioned autism, and the counselor didn't know what she was talking about. My daughter told me about it, and she lost all respect for someone in that role that does not know about autism. Shaking my head. You may be able to educate those teachers about her particular concern. Absolutely. And that was what I was saying. And my husband even mentioned that a couple of weeks ago. Sometimes we get mad at the educators because it seems like they're not doing anything, but the truth of the matter is that sometimes they don't know. So they don't know, but we are here to educate them. So if it is somebody that you feel like Dr. Brenda B needs to be talking to and educating the people at their school, let me know, because that's what I'm here for. Let me know. All right. Miss Dana says she thinks it's great. I'm sorry, I missed that one. Miss Stashi, you're bigger Glover. Welcome. All right. I think it is great. Okay. Miss Harriet Kemp Shaw, welcome. Miss Dana says it's so sad to have so many adults that can't read. Absolutely. One of my friends, though, here in Birmingham is over the Literacy Council. And so we're doing all we can to help even adults learn how to read. Reading really is fundamental. I mean, even if you're traveling, if you're trying to read a map, of course, now we have GPSs that talk to us, but still, you really need to know how to read. That is the foundation for everything that we would do. Miss Jasmine says that was very helpful. I'm so glad, Miss Jasmine. Miss Kemp Shaw says, hello, Dr. B. Hello. And Miss Your Bigger Glover says, hello, Dr. Bowling. And I say hello to you. Miss Paula Moore is watching. Classic Brown says high school is noisy and sensory rich. School, period, is noisy and sensory rich. Absolutely. ADAP is a great source. Miss Catrice Maddox says absolutely. Miss LaShondra Lewis says, hello, Dr. Brandy B. I say hello to you. Miss Edith Powell is watching. Miss Betty Jeffers is watching. April Weatherby is watching. Hello, hello, hello. Candace is thanking me. Thank you to you. Miss Stacy Martin Smith. Hello, hello, hello. That is my friend. If you all follow my page, you saw where I posted the child who is marching in the University of Alabama's $1 Million Band. I am so super proud of him. He did it, y'all. That baby set his mind, his sights on something many years ago, and he is making it happen. We've got Chantrice Perry in the building. We appreciate you for joining us. Miss Trisha King says, hey, Dr. B, I am late, but I made it. Congrats on your years of service. Thank you so very much. It has been one of the most amazing things that I've had the honor of doing. And I don't want to say thank you to me and congratulations to me, but congratulations to all the many parents who have allowed me to care for their babies over the years. I think that there's been some 20,000 kids that I've probably touched, and I do not take that for granted. I don't take it lightly. I'm very pleased to be able to do that. All right, let's see what we got. Cassandra Abernathy is watching. Paula Moore, Dr. Bree, you are so funny. Girl, I just love life, honey. That's why I don't drink, and that's why I don't do any drugs, honey, because I just get high on life. So if you catch me out just acting like I'm drunk, honey, just ask me what good thing has happened to me, because I guarantee you I am only drunk on life. Yes, she's exhausted. Yes, she is very exhausted. She is very exhausted. That mom, I cried. I had to get myself together because I had patients waiting. But I was so sad, and I reached out to my nurse and I said, y'all, she is tired. And we talked about being tired last week. How long do we All right, let's see. Miss Lanisha Mars says, hey, honey, I made it today. We're so glad you made it. Welcome. Miss Nicole McCann, all the way from ATL, shouted, she is here. Hello. Starfall is a good site to utilize to help the children read. So see, there we go. I love it when we are all running something by each other and we are helping each other. Catrice Maddox says Starfall is a good site to help children read. Miss Diane Grady, some schools and states have reading scholarships for elementary school students. So we need to check into that as well. Please do. We got to get these babies to reading. That is so important. Miss Latina Woods is watching. Miss Stephanie Perry is watching. Welcome to you both. Catrice Maddox says, ADAP can explain the process because they had to break it down for me. Absolutely. Ada Elizabeth O'Neill, my son is having trouble with reading and math and trying to get them to retest him on an IEP. And what does a 504 do? So you're trying to get your son tested. That's going to be the basis for the IEP. So like I said a little bit earlier, and if you want to go back and look at the Education in the Law episode with my husband, it was about 2 hours long, really good. And I do recommend ADAP, ADAP, Alabama Disabilities Advocacy Program. When you get there, go to their book. They have a little book with this cute little curly-haired, beautiful little girl on there, and it says special education in Alabama, a right, not a privilege. Just read that book. It's online. If you want to, you probably could print it out. I think it's maybe around 100 pages. But it has everything you need to know about IEP and 504. Okay. And so that is going to be really specific to him because, like I said, not everybody who has ADHD is necessarily going to meet criteria to get an IEP. So the school may be telling you right about that. But if they're offering the 504, make sure that you do that. All right. Are you licensed in Ohio? Girl, yes, I am, honey. Yes, I am. Let me see. Where am I licensed? I'm licensed in, I'm going to get this list mixed up. It's 15. Alabama, Georgia, Florida, Tennessee, Mississippi,
we did have
Indiana,
but I just don't remember when.
Illinois, Texas, California.
So board meeting nights were.
And there's one more.
We had a board meeting on June.
Maryland.
But it would have been after.
And Ohio.
So it would have had to be July.
So I've named something twice, but Ohio is one of them. Ohio is one of them. All right. Driving, but hello, Dr. Brandy B says Nicole. Hello. All right, guys. Anything else? Y'all are running something by me. Ooh, y'all just ought to be tired, honey, because all that running y'all just did when y'all was running by me. Oh, my. Yes. All right. So this is what we're going to do. Now, I want y'all to put some things on your calendar, right? Okay, what we're going to put on our calendar? Y'all got your calendars? Everybody got your calendar? I'm going to stand up. All right? Y'all got your calendars. Everybody got a calendar out? Let me know when you get your calendar. Or you got a date in mind. Let me know. I'm trying to get where I can see myself. All right, y'all got, look at the trees. I feel like I'm at Ola Mills. Miss Edison says, is there a medicine that helps child focus and stay on task independently or just for behavior modification? Is there a medicine that helps child focus and stay on task independently or just for behavior modification? I'm going to try to take a stab at that, Miss Edison. The medicines for ADHD are designed to do just that, to help the child focus and to stay on task. Behavior modification is done in addition to the medications. Let me know if that answered that question, because I can expound if needed. What do we need to do to get on your books? So if you want to get on my books, oh Lord, now I'm going to just tell y'all, the wait is long, but hold on, help is coming. But you can go to rbpsychiatry.com. Dia is somewhere dying. My nurse, she's dying, y'all, right now. As I say that, she is just sliding right out of her seat, thinking, I know she's not telling these people. But I'm telling y'all, it's going to be the first of the year. I'm just telling y'all honestly. It's going to be the first of the year. But rbpsychiatry.com, for RudolphBowlerPsychiatry.com. Go there. The phone number is 205-948-7129. But I'm going to tell you, nobody's going to answer. Listen to the message and follow the instructions. That's what you need to do, okay? And if you choose to submit the paperwork, just put on there, I listen to Focus on It Friday. Not all the people that listen to this episode are going to know that because I've never said that before. I listen to Focus on It Friday. That's what you're going to put on there if you choose to submit the paperwork, all right? Okay, let's see. What we got? Let me see. What do we need to get? Okay, Miss Edison. Mama says good information. Thank you, Mama. Mama's so sweet. I don't care what I say. Mama going to be like, the baby, that was good. That's what you better tell your child, that they did a good job. My mama say it's good. If I forget all the words, mama be like, baby, it's okay. What you remembered was good. Miss Michelle Combs Mitchell says, I got it. Miss Trisha King got it. Okay, let's see. Y'all hold on to your calendars. Miss Lanisha Norris says, I took the route that you mentioned about the school testing. I got the ball rolling, but his teacher doesn't believe a word I'm saying about my son's behavior because he hasn't acted out in her classroom yet. Well, you just keep pressing forward. And remember what I said, that is a good sign if they are not acting out in class. It will eventually come if you do not do something to intervene. So strong work. Miss Edison, yes, behavior disruptions aren't our issue, but the lack of focus and distraction are. So yes, that is what the medicines will do. Miss Jasmine Williams says, are there natural medications that can be used? There are some things that can be used. Some people have looked at omega-3 omega-3 oils. But when you look at the research on that, the medicines were only truly effective in kids who were deficient in that. So you would have to have a child tested to know if they were deficient in omega-3. And then there's some other stuff like Attend and some other stuff that I'm not even familiar with that people are buying over the counter, off the internet and the like. But the truth of the matter is that none of those medicines seem to be consistently effective. And what you're looking for is consistency, because remember that ADHD is inconsistently and your child is inconsistent. That's just too much inconsistency for me. I would rather know what I'm going to get, and I would rather know that if my child knows spelling words on Mondays, Wednesday nights, Thursday morning, and not at all on Tuesday, I want to know that on Friday they're going to know them. And that's what you get when you have ADHD. It's the inconsistency that really is bothersome and worrisome, because you never know which child you're going to get. But there are things that people have used. Unfortunately, I'm not well versed on them, because by the time people come to me, they've already tried all of that, and they need answers. They need help. They're at their wits' end. Their children are about to fail. And so the way I look at it is, it would be malpractice, and just against everything, the oath that I took to do no harm, to tell them to do anything other than what I know is more likely to work. But, do your research on that. I'm sure that there are groups and people who can tell you all about those things, but honestly, they don't work, and I want people to get better. But try them. Try them for yourself. Don't listen to me. Try them, right? And I'll tell you this is another note. Before you go and see a psychiatrist, know that what we do is prescribe medicine, psychotropic medicine, stimulants and non-stimulants. So we're not into the natural medications. So before you make that appointment, and this is for everybody, know what it is that you're going to expect from them. And if you do not want medicine, that's fine. I am perfectly fine with people who do not. I will help you try to find someone who can give you what it is that you need. But just know that somebody wants that spot. They are ready. And so they've been on the wait list 6, 7, 8, 9, 10, 12 months. And, when a parent comes in and says, well, we didn't want it anyway, we just came because, please don't do that. Somebody wants that spot, let them have it. I'm 46 and just got diagnosed with ADHD, and I'm medicated. It has changed my life. I'm highly accomplished, but until you understand the struggle, you have no idea how folks be suffering. And that's the thing, Miss Classy. Thank you so much for sharing that. People are out here struggling, y'all, with ADHD. And it is such an unnecessary struggle. I have a lot of parents, and y'all gonna get me on my soapbox, but I ain't gonna do that, honey. But I like a box, because I am real short, y'all. I am real short. But only in stature, nothing else. Don't get it twisted. But I have a lot of parents that'll say, oh my God, you just described me. And then some of them will say, I don't want my child to be treated because I live my life without it. And so I just simply ask, oh, that's awesome. Did you reach your full potential? And there's dead silence. Because there are a lot of dreams that get left on the table. There are a lot of hopes that get left on the table, all because of ADHD that was not addressed and treated. And so, yeah, you may even make it through med school. Kudos for you. But struggling, it took you 6 years to get out, and you failed several tests several times. And there's no bragging. There's nothing noble about struggling to do something when there is an easier way to do it. And if I'm wrong, I'm going to just ask the Lord to send lightning. Don't strike me with it, but, nearby, around me or something in the woods. So I'll know that I'm incorrect. But I don't want my kids to struggle, and I don't want your kids to struggle. And so that's why it is that I'm doing what it is I do. Thank you so much, Miss Classy Brown, for letting us know that ADHD is real. Thank you so much for letting us know that ADHD does not turn off at 18. Nothing happens in this country at 18 except you can vote. So make sure that you're exercising your right to do that as well. And people are definitely suffering, just like they would if they needed glasses and they couldn't see, just like they would if they needed a cast or a crutch and they couldn't walk, just like they would if they had diabetes and you aren't giving them insulin. People are really struggling out here, and it is so absolutely unnecessary to do that. We've got Me Bella Health watching. Hello, Dr. Mia and all of her staff. Classy Brown says this: I will be submitting paperwork. First of the year is fine. Awesome. Let me tell y'all, though, get on the list. Get on the list. Why do I say that? Because like last week, I had a whole day of appointments. And you know what? We had nobody that we could call who had a complete packet ready to rock and roll. My business coach says if you stay ready, you don't have to get ready. All those people were scrambling, trying to get this, trying to get that, when we ask you to submit everything as soon as possible. Because I may call and say, look, I got an appointment at 6 in the morning, Central Standard Time, And guess what? Parents are ready and on there ready to see me. So go ahead and send everything in, because that list might move just like that. Thank you with the spelling words. It feels like you sat at my home with us doing homework. Absolutely, girl. Because guess what? I didn't just, honey, this ain't my first rodeo or my first spelling test. I am, as my best friend, Keena Bailey says, I am true to this, not new to this, honey. I've been doing this, right? I have seen all the scenarios. I know the buzzwords. If your mom and dad, if your adolescent says that they can't, I heard some rustling over there. I need to make sure. I don't want them to run up on me, honey. I want y'all to run these questions by me, but I don't want no animals running up on me. If your adolescent says they can't get motivated, y'all, that's a buzzword for ADHD. I can't get motivated. Or you say I lack motivation. If you caught yourself saying on more than one occasion that your adolescent was lazy, that's a buzzword for ADHD, okay? If your teacher says this child is doing great, but they hum all the time, y'all, that's a buzzword. If a child falls out of a chair, y'all, those are buzz actions, right? So I'm just telling you all the other stuff that the other people don't even know. They hadn't been looking at it like I have. They don't know. Let me see. Miss Edison says, what's the difference between stimulants and non-stimulants? So Miss Edison, I'm glad you asked that question. So it's really the mechanism of action. And it's also the stigma and people's thoughts and beliefs associated with them. So a lot of times people will say, I don't want my child on that narcotic, right? And so truly they are not narcotics, but they are controlled medications. Legally though, the stimulants, when you get picked up or you've done something bad, they are classified as a narcotic from a legal standpoint. And so that's really what comes with it as far as the stigma. Now, when we're talking about the mechanisms of action, that will be much more than you would care to even know about. In fact, some of the non-stimulants, we know how they work. We know what neurotransmitters like dopamine or norepinephrine that they're working on, but some of how they're doing it exactly is not as well detailed and known. But one of the biggest things is going to be how fast they work. Your stimulants are going to work right away. The day you give it, you're going to see effect. Your non-stimulants take anywhere from, some of them say 3 days, and then it can go as long as 2 to 4 weeks. Right? And so again, that's another reason why I am definitely like, let's get this stimulant started, because when a child comes to see me, we're in dire straits. We may not have a month. There may be 1 month left in the school year by the time they've waited on my list for 8 to 12 months. And so we really need to get this kid to finish strong, even if they are going to have to repeat the grade, because that happens a lot, right? We know that school failure is real with ADHD, not because the kid isn't smart, right? Remember we talked about last week, and what is the big deal? The G in big was gifted. So these kids are highly intelligent, but if you can't focus, because as Miss Jasmine said, it's happening at her house on Friday, if they don't remember how to spell the words, even if they knew it Thursday night, it doesn't matter. They still get that 42 recorded. So we really want to give them what it is that we know is more likely than not to work. All right, let's see what else we got. All right. So, Miss Edison, let me know if they help you. My Auntie Brenda is here. Thank you so much, Auntie Brenda. We love you. You're so beautiful. We just appreciate you for being here. Miss Michelle says, we love you. You are so good with my kids and all my questions. Honey, I just be over here trying to do what I would want somebody to do with me. If I had questions, I would not feel good, honey, and would be ready to fight if somebody didn't answer my questions. So I appreciate you putting that into print. I screenshot all y'all's nice comments. I don't screenshot the ones that aren't so nice. We'll get many of those though. Jeremy Sherry Brown, welcome. Hello, Mrs. Brandy. I'll take that too, honey, because I am somebody's wife. Welcome to the show. Welcome. You are not wrong. I never had anyone even suggest ADHD, depression, anxiety, and maybe. But life is significantly different with the diagnosis and the meds. Your kids aren't lazy or trying to fail or being difficult. Absolutely. In fact, I tell my parents, don't come in here talking about that L word, honey. And no, it ain't lesbian, because we talk about that if that's what we got going on. But the lazy word, we do not allow that in my office. No, 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 no. Nicole McCann says, is Prozac a stimulant? No, ma'am. Prozac is an antidepressant. Prozac is what we call a selective serotonin reuptake inhibitor, an SSRI. It is serotonin at base, and you can go get serotonin or 5-HT off your Walmart, I almost say it's there, but I don't think we had it anymore. Walmart, Walgreens, any of those shelves. It is 5-HT. It is serotonin. It makes serotonin increase in the synaptic cleft. And so what other meds are in that class? So things like Prozac, Zoloft, Celexa, Lexapro, Paxil. Those are all SSRIs. Your SSRIs like Prozac are going to work on depression at your lower levels. And when you get to your higher strength, they're also going to work on anxiety. So they can be used to treat things like major depressive disorder, generalized anxiety disorder, social phobia, post-traumatic stress disorder, PTSD. Remember, there is a large component of ADHD that has, there's a mood component to it, right? It's not a part of the criteria, but it's definitely comprised of a lot of mood symptoms. And so sometimes people will add on an antidepressant in addition to. Sometimes people will mistake anxiety for ADHD. And so as Miss Jasmine said, or Miss Classy Brown said, they will start off with a anxiolytic or antidepressant agent to treat the anxiety for what is truly underlying ADHD. Awesome. That's a good question. Y'all let me know if I'm getting these answers right now, because I want to make sure that we got it right. Miss Candace Page. Styles is watching. Deborah Levert. Charles is watching. Thank you all. Miss Edison says yes. This is helping. I think we need medication. I just don't want it to be habit forming. Will stimulants be out of the system within 24 hours? Oh my goodness. Miss Edison, you making me give away the stuff that I usually charge y'all for. But since you ask it on Run Something by the Psychiatrist, girl, that means I've got to answer it today. So let me tell you about, what did you say? What's the thing? What was the question? Is it going to be habit forming? Okay. So Miss Edison, I think you might be new to the show. So let me welcome you. Thank you for joining. I'm so glad you're here. So now, let me tell you about the stimulants. So stimulants are chemically related to, but are not like, and are not the same thing as what would be street drugs like meth and cocaine. I had a dad Tuesday straight up accuse me of prescribing methamphetamine. Methamphetamine is a street drug called meth, sometimes crystal ice. I think it's the same thing. I don't know. I don't get much into that kind of stuff. Those drugs off the street are very addictive and very potent. Okay, and so I have been told that when you take them, you get high. And when you get high, you want to have that feeling again. These medications do not cause a high. These medications are not as potent and as addictive. And so that's why we have been using them since the 1930s, okay? Now, a lot of parents will say, well, that medication caused my child to run to drugs. Let me just clarify. ADHD is comprised of 3 types, okay? 3 different types of symptoms. You have your inattentive symptoms, your hyperactive symptoms, and your impulsive symptoms. Okay, and I mentioned this a little bit last week. So if you missed last week's, please go check it out. What's the big deal? Because what happens at about 6th and 7th grade is that all your kids who've been doing great on medications, making all A's, doing wonderfully in the world, they are going to be the next physician and everything else. You're super excited. They get to 6th and 7th grade and they decide they don't want to take them anymore. They either don't want to come see me, their friends are laughing at them, who knows? I don't know. Also, about that time, you are allowing them to be alone and without you and to go and do age-appropriate things. However, also at this age, you're extremely impulsive at baseline just because you're an adolescent. And then if you have ADHD, you have an extra level of impulsivity that is associated. So what do? Somebody offers you something, you forget about your uncle that it didn't work out for when he did drugs and alcohol. You forget about your mom, your dad. You forget about all those people. Because guess what else happens at about this age of adolescence? You're invincible. So nothing's going to happen to you. So what happens then, we've got a child who is now not medicated and they are extremely impulsive. They try something, they try something, they try something, they keep trying, they move from this to this, they move from this to this, they move to this, and they find cocaine in there. Then they can focus. Now all of a sudden they can focus. They're making good grades again. Hello. All right, they're making good grades again, and then life is good. But what they used to help them focus was extremely addictive and potent, and so now before long, they're homeless and without teeth and losing possession of their kids. All right, so hopefully that made sense. So there's a difference between a medication that is prescribed leading you to be on drugs and not treating ADHD leading you to be on drugs. Hopefully y'all caught the difference. If not, rewind it and watch it again and again and again until you see it. Will the stimulants be out of the system within 24 hours? That is typically about how long they go. So how do we know that? I mean, if a stimulant is working and you forget a day, the teacher's going to call you that very next day and say, oh, did y'all forget something? So that's how we know that you have to give them every day that you want them to work. Okay? Miss Melissa Ann is watching. Hello. Do you do psychological testing in kids? I do not. Do you do psychologist testing? So psychological testing is done. Some psychiatrists do. I do not. Most of your psychiatrists are going to prescribe medications. But psychologists do testing, and psychometrists are in the schools and they do them as well. Miss Edison says, I am new. Well, girl, we hope you have enjoyed yourself and we want you to come on back. Let me know if you've enjoyed yourself. Let me know if you have enjoyed yourself. All right, so Melissa Callan, hello. Miss Deborah Jackson, hello. Haven't seen you in a while. Miss Lanisha Morris says, I wouldn't say my son is lazy, but he's very inconsistent. My child also focuses on things that he loves, such as math and science. If it doesn't include one of those things, he will not focus on it. He swears he forgets to do everything. It's like math has his attention non-stop. He's always counting. I cannot wait to get to the bottom of this situation. Absolutely. So you pulled up a lot of different things in that, right? So we know for a fact that, let me just say this. This is one of my coin terms. You heard it here first. Concentration is not fascination, right? So there is a difference between concentrating on something and being fascinated by something. I don't care if it's reading and math, if those are your things, right? If it's only that you love reading a certain topic, but you don't like reading other topics, then that for you means that reading that particular topic of interest is fascinating for you and is not concentration. So yes, I will be happy. Let me know if there's anything that I can do to help you get to the bottom of it as well. Miss Melissa Ann is waving. Welcome. She's a regular over here. Let's see, Miss Classy Brown. You don't get high. For me, it's like having a messed up knee and needing a cane. Because of the cane, you can walk better. When you take the cane away, you walk the same. Your knee is messed up regardless. The cane is an aid. Knee is broken, needing a cast, it is forever problematic. Meds are an aid and not a crutch. And as I say, if you need a crutch, you need a crutch. Right? If my right leg is broken, or if I don't have a right leg, I need a crutch. So I don't really care what you call it. Just give it to me. Call it a crutch, call it a walker, call it a hopscotch. I don't care. Can I move? Just give me a wheelchair. Let me sit down. Because sometimes I just want to be lazy. Let me sit down and push me around, honey. I don't care. Did I get an A when I got done with it? That's all that matters. Or did I hop on one leg and tell people when I finally got to the finish line? Everybody else got there 3 days ago. And I got there 3 days later and said, but I made it. And everybody else like, okay, give her a cookie. She hopped. When they all took their aids. Crutch, wheelchair, whatever. Just get there. If you need a crutch, you need a crutch. Hallelujah. Do you serve Alabama? Do I serve Alabama, girl? I live in Alabama, honey. I am right here in Birmingham. Yes, ma'am. Tell me how you found me. How'd you find me, Miss Edison? I'm so glad you did. Girl, you gonna have a ball over here with us. Don't we have a good time on Focus on it Friday? Don't we have a good time, y'all? We have a good time on Focus on it Friday. All right. She said, do I serve Alabama? Girl, I am sweet home Alabama, honey. I am sweet tea myself in the flesh. I am a grit, honey. A girl raised in the South. Yes, ma'am. That's me. Yes, ma'am. Miss Angelica Langford says she is loving it. Okay, I asked y'all to bring out your calendars. Y'all thought I had forgot. I did not. I was just making sure that all this stuff that these people wanted to run by me, honey, that they got a chance to do so. But this is what I want you to do. I want you to identify a date on the calendar. Just pick a date that looks pretty open. Everybody got a date in mind. If you don't have your calendar, just think of a date. And on that day that you're thinking of or that your finger is on, I want that day to be about you. I want that day to be about you. I want you to take yourself out to dinner. I want you to take yourself to the movies. I want you to tell everybody, go to get a hotel room. I want you to tell your spouse or arrange for a babysitter to keep those kids for 4 hours. 2 hours. That is your day. And I want you to do that in the next 2 weeks. Because all of y'all are good, busy moms. We all are. Being a mom is super hard. Being a mom is super amazing. Being a mom can go from 1 star, would not recommend, all the way over to, on a 5-star scale, it could be 7. When they wake up in the morning and say, hey, mommy, you look beautiful. Especially when your sons say that and they jump up in your arms. That's a beautiful thing. That's a 7-star day on a 5-star scale. But those days when you get called to that school 3 times in a row and you got to go pick them up, that is a day that it is definitely 1 star and you would not recommend. But I want you to reward yourself because you're good parents, right? You don't have to be great parents every day, just every once in a while. And the truth of the matter is that I am right there with y'all. Y'all know I have 3 kids, 3, 6, and 7. And y'all know that little girl is something else. She's a mess. But I love her. I love the other 2 as well. And we're just doing the best we can to stay afloat, to stay alive, and to do, to make life easy for our kids, right? We always talk about wanting life to be better. But I want us to get in the mindset of the fact that being better is being easier. If my kids don't have to struggle with something that I did, and honestly, I don't know any struggles. My parents made it so that we didn't know struggles. I didn't know I wasn't rich, or they weren't rich because I ain't had no money. I didn't know that they weren't rich till I got to college and realized that I was really around people who were rich. My parents just made stuff happen. And isn't that what life is all about? Making stuff happen, making it easy for our kids. I'm not saying give them everything and make it super easy. But I'm saying remove the roadblocks, remove the challenges. And ADHD can present roadblocks and challenges for your kids. Make it so that their dreams can come true. Make it so that they can excel in the classroom and in life. Oh, Lord, Tina said, I'm getting all these patients. Girl, I'm going to have to hire. Because Dia going to tell me that she can't go do it all. I bet Dia ain't on here. And if she is, honey, when I posted that phone number and that website, she probably logged off and said, Dr. Rudolph Bowden. Oh, Lord, she's hiding. She may not speak for me for the rest of the weekend, y'all. Miss Edison says, oh, my God, this is divine. I'm about to get on the waiting list and be ready. Get ready, get ready, get ready, get ready, get ready, y'all. Get ready. Miss Michelle Mitchell says, do you take appointments in person instead of on video to do one-on-one with my high schooler if that helps her more? Right now, I am not, Miss Mitchell. I'm not. Because I see kids all over the state, and so it allows me a lot of flexibility to be in a lot of different places within moments. And so right now I'm not, but when y'all actually free up some time of mine, when I free up some time, who knows what might happen. I might be open to some other things. There's all kind of things coming that are in my mind, right? Miss Lanisha says, yes, let me go ahead and book this room. I've been procrastinating so long. You better go get that book. Go book that room. Absolutely. Miss Classic Brown says, I think people think that med shortcut hard work and they miss the whole part that neurologically we are different forever. Our brains are wired differently. Absolutely. And so that's why we use terms like neurotypical and neurodivergent. Neurodivergent takes into account, y'all stuff out here biting me, honey. I don't do outside for real. Did y'all see that episode of me on the beach? I was under that umbrella hiding from the sun like I had stole something from it. I don't be outside like this for real. But yes, neurodivergent and neurotypical, meaning that we divert. Those people who have ADHD are divergent or divert from what is typical about the brain. If you read my book, Shine, Understanding ADHD So Your Child Can Be a Star, I explain what the neurological basis is for ADHD. So this is far from hocus pocus and made up. It's a real life thing with real life people impacting them. And so thank you so much, Miss Classy Brown, because honey, I be over here just preaching. I'm all parched about the throat, and you are just telling these people from a real life situation, from an adult who experiences it. Because that's the thing, our kids oftentimes don't have the words to tell us what it is that they're experiencing. So here it is, you have it from an adult who has it, because I don't have it. And so I don't know what it feels like, but I know what it looks like. And so I am so grateful that God allows me to be able to help those who do have it. Tina said she gonna come work for me for free. I appreciate you volunteering, Tina. Auntie Wanda is watching. Hello. Dr. Andrea is watching. Always the best, Pearl. She says, thank you, darling, so much for coming over and being a friend. If you all are in the Erie, Pennsylvania area and you need an OBGYN, y'all better go hit up Dr. Andrea Jeffress. She is the one that you need to know. Also, if you need a video done for your business, Dr. Andrea will help you as well. Dr. Andrea has a child who is now a physician. She also has a child who is on University of Pittsburgh on their basketball team. I think that's right. Let me know if that's not right, Dr. Andrea. Tina says she knows she will. All right, girl, you'll be over here video serving at the front desk and making t-shirts. Everybody come around here, get a t-shirt. I love it. All right, let's see. Wanda Harris. Yes, ma'am. Hello, hello, hello. I got it right. All right, I got it right. What's the website and the phone number? We're going to give you this website and this phone number. It is www.rbpsychiatry.com. That is Rudolph Bolin Psychiatry. That's the name of my practice. And the website is www.rbpsychiatry.com. The phone number 205-948-7129. Don't y'all tell Dia that I told you, but if you're coming from over here, go ahead and write on the top of your paperwork, because it is old school now, but it is getting revamped. Believe me, we are coming up into the 2022-2023 era. But for now, when you print it out and send it back, write, I watch Focus on It Friday. I watch Focus on It Friday, all right? We're going to do something special for the first 3 people that get a full packet in. Now, I will go ahead and tell you, if you're outside of Alabama, I do not take insurance. So just hold on. Just hold on to what you got. Hold on to what you got if you don't have insurance. But go ahead and get your paperwork in. But just know that I am not on any insurance panels outside of Alabama. All right, y'all. It's 1:27. Y'all got anything else that y'all want to run by me? Anything else? Because this is the last time I'm going to be talking about medicines, honey. The next time you're going to pay for all this good information, all this good knowledge, and just giving it away for free. For free. Please talk to your friends whose children are bullies. Make sure that they know that they need to be talking to them about that, right? Because something is going on. They need to get that addressed. Okay? Anything else? I watch Focus on It Friday. Yes, yes, yes. Yes. And so make sure that you print I watch Focus on It Friday when you send in your application. If you're already seeing me, do not change clinics. Please don't change your clinic, because it's the same me. It's the same care. So don't move your clinic. All right. Have a wonderful rest of my day. So helpful. Kania calling, my cousin is watching. Thank you all so much. Miss Angelica Langford says, thank you, Dr. B. Great information. Thank you for being an amazing parent. You all are fantastic. I want you all to know, if you saw me last night in clinic, we are still trying to get medicines entered. So if you called your pharmacy and they are not there, that is okay. If you talked to me today or saw me today, your medications have been entered. But last night, the system went haywire and we had some technical difficulties. So your medicines may not be in. We appreciate you. Prayers for the mother in need. Absolutely, says Miss Trisha King. Classy Brown, dang, that's just a little too far away. Oh, honey, we do them electronically, virtually, honey. Visits are 100% virtual. So, yes, you are never too far, unless you don't have internet, because it'll be a long run back and forth. My Auntie Eva is here. Thank you so much for joining. So much for joining. All right, guys, I am going to get out of here. I appreciate you all so much. You all, as I tell you every single week, you all are the best part of Dr. Brandy B. Without you, there would be no Dr. Brandy B. Miss Marley is here. Hello, Miss Marley. I'm sorry, Dr. Marley. Dr. Marley is my ER physician in Indianapolis. She is taking care of those babies in the ER at Riley Hospital. I guess she's still at Riley Hospital. where I trained. Met Dr. Marley some years ago and absolutely love her. She's a doll, baby. My auntie Eva says, hello, beautiful, and right back to you. But I'm going to get out of here, y'all. I really do want you to take care of yourself. So that date that you just circled on your calendar or that date that you have in your mind, go book yourself a hotel room. Go book yourself some ice cream. Do something without those kids. Do something without your husband. Do something without your work. Even if you have to leave the phone in the car for about an hour, just do that for yourself because we're stressed out with so much. 2 weeks ago, was it last week? Last week, honey, we talked about these entanglements and these trapped in the middle and these love triangles that we got going on with our kids, our spouses, our parents, and our jobs. And sometimes we need to just rest. Miss Wanda said already booked. Tina says always good information. I just love y'all because y'all just be, my head be so big when I get off of here. Golly, I have to just go punch a hole in it and let the air deflate out because y'all just love on me and I appreciate it. All right, go ahead though. While you got your calendars out, go ahead and book a Saturday. I don't know which one, but in January, we are going to get together for Mommy's Time Out. Okay, if you are not on my wait list, I want you to do this right here. I want you to go, not my wait list. If you're not on my email list, this is super important. Super important. I want you to go over to, oh goodness. I'm going to watch out for me to put a link at the end of this post. And I want you all to go over there, sign up on that link. It's free. It's not a trick. You'll get a video. And I want you all to sign up on that list and get on my email list because I'm about to start emailing you. I'm about to start talking about the event that's coming up in January, and I don't want y'all to miss it. Classy Brown says, not an OBGYN. Kind of need to see that. Oh, girl, I didn't know. Oh, Lord. Wait a minute, but tell me where you are, girl, because I got OBGYNs wherever you are. Send me a message. I thought you were talking about me. You talking about the OG. Yeah, girl, she got to touch you. Send me a message about where you need somebody, or if you want to, you can put it here, and I will let you know where it is that I've got some friends and some mobile friends, and we'll get you all connected. All right, y'all, I'm good out of here. Dr. Brandy B. Don't forget, check this email post in a few minutes. I got to think of the website, but I want you to go there and get on my email list. That's very important because, y'all, a lot of stuff, I'm telling y'all, this last quarter, I'm going to be blowing up like a rocket. Well, not really. I'm going to just take off like a rocket. Let's say that, not blow up. Oh, Jesus. I'm going to take off like a rocket. But I want you all to be involved and be aware, be updated. So, I'm Dr. Brandy B, your triple board certified pediatrician, adult psychiatrist, child and adolescent psychiatrist through my Facebook. Live stream Focus on It Friday through my book. Please get your copy. $20. Am I not worth $20, honey? Y'all coming over here getting this free information. $20. That's all I ask for Shine. It is invaluable information. All the questions y'all are asking me, I promise you it's addressed in the book. The medications are detailed in a whole chapter that I've devoted just to medications, in and out, side effects, pros and cons. And someone asked what are other options. I list them out. I list every single one of them out and tell you the pros and the cons of each of them. And I just don't know them off the bat because I don't use them. I use what I know works. But anyway, let me get on out of here. Dr. Brandy B, I love y'all. And nothing you can do about it, as my auntie would say. I want y'all to take care of yourselves, take care of your babies, do what's best for them. And I will see you all next week. Same time, same place. Who knows where I'll be. But I'll be here with you all. Have a good weekend. Take care of yourselves. Bye.